Today, joining me is Dr. Green and Ramakers, the Laboratory Director at Erasmus University Medical Center in Rotterdam, Netherlands. He has more than 10 years' experience in clinical chemistry with research interests in laboratory automation, preanalytical variation, core clinical chemistry, and fecal biomarkers. So, Dr. Ramakers, how do you like your coffee?
Thank you, Saul. Well, I like my coffee partially filled. No milk, no sugar.
Well, that's very specific.
Yeah, being accurate is just as important for coffee as it is for diagnosis. After morning rounds, I recently discussed this with an ED colleague, and we discussed the importance of hemolysis and its implications for patients presenting with chest pain in the ED. Well, hemolysis refers to the rupture of red blood cells. Now, when hemoglobin is released from ruptured cells, it gives a reddish color to the serum or the plasma. It's one of the most commonly encountered preanalytical interferences seen in the clinical lab. This issue is more prevalent in the ED because of the cannulated draws. Well, hemolysis is known to interfere with troponin assays, and the impact varies depending on the type of assay, automated platform used in the lab, and the degree of hemolysis, and many other factors. And when troponin test is used to triage a patient with symptoms suggestive of acute myocardial infarction, sample quality is critically important. When there is a negative interference due to hemolysis on the troponin assay, causing the troponin levels to be artificially low, the ED might incorrectly release a patient who is experiencing a heart attack. Or conversely, if you triage based on the change of troponin levels in time, the first sample being falsely low due to hemolysis, the second being non-hemolyzed sample being normal, the patient may be sent to the cath lab for procedures that are not needed. Sample quality directly impacts the diagnostic accuracy for patient diagnosis. Bluntly put, at least in my ED, the doctors want results, but they are not always aware of the impact of sample quality on diagnostic accuracy. Therefore, it is critical to educate the ED doctors on how to interpret mildly hemolyzed lab results and to come up with ways to reduce the number of hemolyzed samples coming from the ED.
Absolutely, I completely agree. I'd like to point out Dr. Ramakers' publication in Clinical Chemistry and Laboratory Medicine. It shows a reduction of hemolysis with the adoption of partial draw tubes.
Yeah, what we did in this study, we focused specifically on chemistry tubes coming from the emergency department. And what we saw is a 10.2% percentage of ED draws that had hemolytic indexes of more than 100 micromoles per liter. And by introducing partially draw tubes, this percentage dropped to 1.2%, which is below the 2% hemolysis rate benchmark, which is adopted by the American Society for Clinical Pathology. Hemolysis rates is easy for labs to attain, and it's an excellent tool to improve patient care. By reducing hemolysis rates, partial draw tubes directly improve reporting rates of various tests, such as potassium, LDH, liver enzyme, CK, etc., which is of special importance in a hectic ED setting where lab results are crucial for triaging a patient.
Absolutely, yes. In that hectic ED setting, due to workflow and the use of IV catheters for blood collection, the device connections are not always optimized, creating turbulence in the flow of blood. Using partial draw tubes with lower vacuum can reduce that shear force in the blood and thereby reduce hemolysis. Therefore, to deliver an accurate diagnosis, finding a systematic, sustainable approach to track sample quality is essential, so that feedback can be provided to the nurses and phlebotomists and to enable better sample collection practices.
Very true, Saul, very true. In the ED case, knowing the reason of the ED to perform a cannulated draw, such as using an IV catheter, one-stick policy, patient satisfaction, and knowing the reason why a cannulated draw is more prone to be hemolytic, increased stress on red blood cells. We came up with a solution, the introduction of a partially draw tube with reduced vacuum, that drastically improved sample quality and seamlessly tapped into an already existing workflow in the ED.
It would be helpful to have educational sessions for laboratorians, nurses, and even physicians regarding the importance of diagnostic accuracy and the potential causes that negatively impact it.
I fully agree. I also want to raise awareness that sometimes coming up with a unilateral solution to fix one problem might have unintended consequences. I believe that there is very great value in the exchange of knowledge between the lab and the clinic. Understanding one another's workflow processes adds value to the healthcare system. With the more open and bilateral conversations, there will be more appreciation for each other's work, and we're all doing it for the benefit of the patient after all.
Thank you for watching, and stay tuned for the next episode of Coffee with Saul.